Okay. Rise your hands on the folks.
Thank you, Ross.
You're welcome, sir. Thank you for
Did
coming.
anybody come from further away than Louisa County this afternoon? I heard Colonial Heights.
Louise County.
You deserve some kind of award if you did, because I'm telling you, it's nasty. That's all right. Good luck on 95 and 7. Hey, George, you split the award, I guess. Russell asked me to talk this afternoon about quote-unquote choosing a portable concentrator. And you'll see on the outline that I passed around that that's in quotes. I'm going to kind of start with that topic and ultimately end up with it, but I want to talk a little bit about some history of where we've come from to get to where we are today. Oxygen was first discovered in 1774 by an Englishman named Joseph Priestley. He didn't really know a whole lot about what he discovered. About the only historical value he gets is that he discovered that oxygen would support combustion. Nothing much happened for a few years until 1777. A Frenchman by the name of Antoine Lavoisier rediscovered oxygen, and because he was French, he didn't call it oxygen, he called it dephlogisticated air. There's no real good definition of what that is. He kind of puddled around in a lab with his discovery for a while, and lo and behold, the first documented use of oxygen in about that period of time was for the treatment of syphilis. Now, you have to stop for a minute and think that nasal cannulas, like several of you are aware this afternoon, hadn't been invented yet. So nobody's real sure how he administered his dephlogisticated air or oxygen. Now, I guess we really don't want to know if he was treating syphilis with it anyhow, but that's just a little bit of history. Oxygen is a free element available anywhere in the Earth's atmosphere at 21%, 20.95 actually. Whether that's at sea level at Virginia Beach or at Mile High Stadium in Denver where they played football yesterday, you saw some people huffing and puffing, and even heard a couple of references to the thin air, if you will. There's 20.95% oxygen in the atmosphere at Denver at 5,200 and however many feet, just like there is at Virginia Beach. The difference is the barometric pressure causes the oxygen to be absorbed and diffused differently. That's why athletes who go to Denver for the Olympics or whatever usually train at a different point and so forth to get there so they can better utilize the oxygen. I've been around a long time. I go way back to the early 1970s, a little bit before that in the Army. And I can remember training in Winchester. And the only oxygen that was available early on were great big welding-sized tanks. And in fact, they were supplied by welding suppliers. To the point, that was in hospital, nursing home, or whatever, it was at that point unheard of for somebody to be at home on oxygen. And that was true up until about the early to mid-70s, I guess. I can remember calling Valley Welding Services in Winchester to try to make arrangements for one of the first patients that I involved myself with to go home to someplace in West Virginia. And the first question that the receptionist from the welding supplier asked me was not how many liters per minute is the patient going to use, or is the patient just going to be on oxygen at night, little things like that. His question was, how many steps are involved? And picture for a minute, if you can, following a truck with great big green tanks on the interstate or whatever. Those are the kinds of tanks that were delivered at home before concentrators, before resistance, and so forth. And I guess if I were that guy, I'd wonder how many steps were involved too. Because you can imagine having to lug a quantity of those things in or out of grandma's house. Because tanks don't last very long. We'll talk about that.
What did you say? Do not last long?
I mean, even the great big industrial size tanks may last 24, 36 so, if one was going home to West Virginia from Winchester, they might have to have 10 or 12 tanks in there.
I have a rather large tank in my house for emergency.
Yes, sir.
You know, it stinks.
Yes, sir.
About this size.
He's talking about an emergency backup tank. Yes, sir. That's purely for emergency purposes.
Right.
You would not want to depend on that
Right.
for your
No.
sole source of oxygen
No.
these days. Fortunately, you don't
You know,
have to.
just for power outages and stuff.
Correct, correct. Industrial suppliers were the sole source of oxygen for, again, hospitals, acute care, nursing homes, any kind of extended care, and even the early home care environments. Fortunately, in the early 1970s, a couple of companies came up with something called an oxygen concentrator. Oxygen concentrators are electrically operated. They have to be powered. They literally make their own oxygen out of the room air. Again, we're all breathing 21% oxygen unless it's enriched. But what a concentrator does is draw in the same room air that we're breathing now, separate the oxygen molecules out from other gases in the air, and deliver it downstream through a 7 or a 10 or a 14 or a 25-foot tubing to relative purity. In fact, revolutionized somebody being at home requiring oxygen. They're still in existence. The first ones were 3 times the size and probably 10 times the noise. If you think one of these things that you have now is noisy, just try to backtrack about 30 years and imagine some things. We probably need to get a little bit out of order here, or I will get out of order here, and talk about Medicare and how oxygen came to be involved with Medicare for reimbursement purposes. John Kennedy and others came up with Medicare in 1965. And Lord knows it's nowhere close to what it was in 1965 today. Oxygen was in fact not involved in the early Medicare reimbursements. It was added several years later. And it pertained only to stationary oxygen in this town, whether it be his big bulky tank that he uses for emergency purposes or a concentrator or whatever. Portable oxygen was subsequently added as a reimbursement issue a few years later. Medicare has gone through phenomenal change. As far as an equipment provider is concerned, the biggest change, I guess, has been the reduction in reimbursement. When I first started in home care, oxygen was reimbursed on an allowable of $498 a month. And if you want to turn around and look over your shoulder, look at those people in the back row laughing. The oxygen reimbursement now is about half that, down about $220 a month, and in fact, only 80% of that. So whereas technology has changed, Lord knows the need has changed, reimbursements have been reduced. And all of us in this business have learned to do more with less. We've had to do that. I think, however, the biggest change from a Medicare reimbursement perspective happened in 2008 when our friends in Washington decided to classify oxygen as a capped rental, or put it under what's called a capitation reimbursement. Years before, starting back in the 70s, oxygen was available to you and you and you and you and anybody, month after month after month, year after year after year, until you no longer need it. That all changed in 2008, and I'm coming to a point here, I really am. That all changed in 2008 when Medicare decided that they would only cover oxygen for 36 months. I see some eyes going up already. You might not be aware of this. But depending on when you started on oxygen, you may, and I think she has, we've talked about that's one of the things she and I talked about. You may be in a situation where your company, your provider, is not being paid to provide your oxygen. And you're, of course, saying, well, how can that be? That's not what Medicare is all about. Well, it is, as far as oxygen is concerned, since 2008. So after 36 months of payment, whether that's 36 continuous months or 18 months with a couple month break while you're in rehab or whatever, after 36 total months, Medicare stops paying for oxygen. But that doesn't mean that somebody from Louisa Home Care or Lynn Care or Roberts Home Medical comes knocking at your door and say, I'm really sorry, but your oxygen's not being paid for anymore, we're going to take it away. That doesn't happen. It has been attempted to happen in other parts of the country, but I don't think that would ever be an issue here. What basically happens after 36 months is that for 24 more months, you keep your oxygen, you use it daily, we don't get paid for it. At the beginning of month number 60, a provider can provide you with new equipment and start the clock all over again. Folks, I'm going to tell you it's the stupidest thing the government's ever done. Because not a lot of people can be in business and give their stuff away. This would be a very easy business to be in to give it away, as it is. But it's a fact we all have to live with it. And the reason I'm telling you all that is some of this new stuff that we're talking about, that being portable oxygen systems, tanks of whatever size, or particularly portable oxygen concentrators, aren't cheap. You have, I only see one, you have liquid. I'm sorry. Does anybody have a portable concentrator?
Yeah.
With you? Anybody bring it today? Okay, I'll try not to use you as a guinea pig, but I may now that I know somebody's here. I see a lot of people with tanks. And tanks heretofore have been pretty much the only choice as far as lighter weight portable systems for somebody to get out of the house. But about, not quite 10 years ago, a company came up with a product called an Inogen, and it was the first real good portable oxygen concentrator that was available. It was battery operated, it was relatively lightweight, small, pretty good battery time, relatively easily recharged batteries, and so forth. I used that concentrator at another company with pretty good success. There were some battery issues, well, that nobody wants serial number 0001 of any kind of machine, whether it's a TV or a refrigerator or anything else. It's certainly not an oxygen machine. But all of a sudden, here we are a few years later, and there are probably at least 8 or 9 portable oxygen concentrators available. If you don't believe that, just get online and look, just Google portable oxygen concentrator and brace yourself. I will tell you straight up, right away, with no clause or cause whatsoever, try to stay away from internet purchases of virtually anything medical, especially portable oxygen concentrators. Because I've had this, and I'm sure the others have as well, phone calls from people who have purchased portable oxygen concentrators from some internet source they don't have a clue when, where, why, that are having battery issues or service issues, and those folks are forgotten. So, ultimately I'm going to talk about choosing concentrator. Choice number one is to only deal with somebody local that's going to be there tomorrow that you can trust. We've got good examples in the back. Yes?